Good morning, everyone. Good morning. This is AARP, Arizona Hispanic Connection. I am your host, David Parra. Today we have a very important subject. It's called ACA Explained. And today is the 26th of August, 2017. And as of today, the Affordable Care Act is still the law of the land. We expect changes. I think they will definitely come. We do not know when. We do not know what type of changes they'll come. But one thing we know, they will come. So we're going to be talking with our guests today, three of them, and I will introduce them in just a little bit. But before I do that, I would like to welcome Dr. Len Kirschner. He is on the phone, and I have asked him to help us understand the history of healthcare in America. I believe a lot of times when people use names such as Obamacare and other names, it may give the impression that this is a new issue, but it's definitely not. And that's why I have heard Dr. Len Kirschner, and he has an amazing career. He's currently retired, so I'm not going to read all his accomplishments, but suffice to say that he was in the 80s the Axis director, and he has a long career, over 20 years with the Air Force, and he's also been with AARP as a volunteer, state president, and the like, for many, many years. So, Dr. Kirschner, are you on the phone?
David, I'm here.
All right. Well, thank you so much, and thank you for joining. Would you mind help us and everyone listening and watching through Facebook Live, help us understand that this is not a new issue, but that there's a whole history around healthcare. Would you mind?
No, I'd like to. David, we've had this conversation, and the whole issue of politics and healthcare go back to George Washington and John Adams, our first two presidents. John Adams actually signed the Merchant Marine Health Act in 1798, which said that merchant mariners had to pay into a pot to develop a healthcare system. To fast forward, Teddy Roosevelt in 1912 was running on a platform that said we should have social insurance for healthcare in this country, similar to what Germany had started in the 1880s. He lost the election, Wilson won, but moving forward, Franklin Roosevelt, his cousin, became president in 1932. He wanted Social Security and health reform. He got Social Security. We got World War II, wage price controls, and we had the employer-based system that we've had. Since then, every president since Roosevelt has been involved in trying to reform the healthcare system. Am I coming across loud enough?
You are coming across perfectly. Yes, so go ahead and continue, because I know you do a presentation an hour and a half long. I've heard it, and I love it every time I hear you. And I know you bring us all the way from Teddy Roosevelt all the way to Barack Obama. So go ahead and proceed.
Well, Harry Truman tried twice to get a national health system, and the American Medical Association fought him, called it socialized medicine. Jack Kennedy was elected in 1960, and he wanted something called Medicare, could not get it through the Congress. He was assassinated. Lyndon Johnson became president. He beat Barry Goldwater in that 1964 election. And in July of 1964, he signed Medicare and Medicaid into law. That was the culmination of 50 years of effort.
1965, that would be Medicare and Medicaid.
Yeah, the two programs, and they were signed at the same moment by Lyndon Johnson, and Harry Truman became the first Medicare beneficiary. Interesting.
Now, so by this time, Len, then the group insurance was in place already, correct?
Yeah, Blue Cross had started in 1929 in Dallas and had grown. It was a hospital insurance program. Blue Shield had started in Dallas in 1939, and that was for physicians. And so Part A of Medicare was like Blue Cross, Part B was like Blue Shield, and the Medicaid program was in place for the poor. And the states had the option, and of course, Arizona was the absolute last state to start a Medicaid program. We waited 17 years.
Now, in terms, Len, so we have Medicare, Medicaid, we have group insurance. Does that also include the insurance that federal jobs offer their employees?
Yeah, that's part of the model that we have with the employer-based system.
Okay.
So most federal employees, state employees, government employees get health care because of their jobs, just like many of the people who are working who are on this phone, on this radio call. That's about 170 million of our 320 million in this country. Mm-hmm. Medicaid has about 70 million covered lives, and Medicare about 50 million. So
wow.
They're large programs. To fast forward, Richard Nixon signed the Managed Care Act. He was worried about the cost of health care. Ronald Reagan signed a number of laws that impacted health care, including saying that if you go to the emergency room, they must see you. And then George H.W. Bush signed into law the Americans with Disabilities Act, which was a major expansion for health care for people with disabilities. But it took the Clintons taking office in 1993 for the Clinton plan, and that was a major battle that took place in the Congress. That law never got a vote, and we moved on. George W. Bush signed Medicare prescription drug bill into law because we'd wanted prescription drugs in Medicare since the law had been signed and never been able to do it, but he did that. And what was interesting is that Trent Franks, our Arizona congressman, passed the deciding vote in the House. And then we got President Barack Hussein Obama. And the issues were that we had 50 million people uninsured, the costs were escalating, and the quality was questionable.
Right.
So the Affordable Care Act was pushed through the Congress eventually by a party line vote, just by Democrats, and it was signed into law in March of 7 years ago, 2010. So that law has been contentious since then, although today the popularity of the law is higher than it has ever been. Mm-hmm. The unpopularity has basically dropped down dramatically. However, the Republicans, clearly we all know, campaigned for 7 years on repeal and replace. In November of last year, Donald Trump won the presidency in a very contentious election, and he became president on January 20th. He had said he wanted a bill to repeal and replace Obamacare on the first day he was in office. That clearly has not happened. And so the battle in the Congress this year has been dramatic.
Right.
The House of Representatives tried twice to pass a repeal. They did on the second time. It went to the Senate. And the Senate battled over it dramatically until that last vote, which took place last month, when John McCain had been diagnosed with brain cancer, came back to Washington, went on the floor of the Senate with the vote at that time, 49 for a repeal, 50 and 50 against. If John McCain had voted to support the bill, it would have then been a 50-50 tie, and the Vice President, Mike Pence, would have cast a deciding vote, and the bill would have ended up going to a conference committee. John McCain came in one of the most dramatic moments in the history of the United States Senate, walked in about 1:30 in the morning, waved his hand and said, "Recognize me." He was recognized. He walked up to the desk with Senate Majority Leader Mitch McConnell standing there, the Vice President standing there, and he put his fist out and went thumbs down, no.
Wow.
And the bill failed. It did not pass. Mike Pence did not get a chance to cast a deciding vote.
Well, Dr. Len Kirschner, thank you so much for helping us understand the history of healthcare in America.
David, thank you for having me on, and we'll see what happens next month when the Congress returns on the 5th of September. They still have healthcare, the budget, the debt ceiling, infrastructure, tax reform, and a whole host of other issues. It's going to be a very interesting month.
Thank you so much. Have a great day. This was AARP Arizona Hispanic Connection.